it's very important initiative that SRM has taken. So I'm very happy to be a part of this training program. So of course, let me begin by congratulating the organizing team. So we have like various professors, Dr. Nagarkar, Dr. Helen Saji, Dr. Sangeeta Raja, Dr. Kalavali, Dr. Venkataraman, both Venkataraman, Dr. Ravi Kumar, and all the faculty and staff for bringing together such a diverse group of healthcare professionals who is going to be the future trainers, because this is supposed to be a training of trainers. So you are going to train other people. Obviously, this initiative is a clear initiative, so indication of your commitment to advance the health for transgender people and people with intersex variations. So very, very important initiative. Of course, why I think like this training is significant. There have been trainings going on of course, for example, I myself I have attended, like I have participated and provided training in other colleges as well. But I think there are very few hospitals. Even then, I can only count on my fingers, like how many hospitals, private hospitals, especially they have this kind of like initiative. You are planning to have this initiated in your hospital. That's a very welcome initiative. So as healthcare providers, we have a responsibility actually to serve everyone, irrespective of say their caste, religion, age, gender, everything, right? So accordingly, it's very obvious like we also need to be serving transgender people and people with intersex variations. In both my talk and also in Dr. Uma Ma'am's talk, we also highlighted the difference between transgender people and the people with intersex variation, because that's also important to understand for the healthcare professionals. So I will say it again because there are also like some new people. So transgender people are those whose gender identity differs from the gender assigned to them at birth. But for people with intersex variation, they may have some variations in relation to their external genital appearance or chromosomes or in relation to hormones. So this is the important difference between transgender people and people with intersex variation. We also in the morning session we spoke about like different guidelines which are focusing on medical management of trans people and medical management of more than 40 different conditions like of people with intersex variations. So knowing those are very this distinction, and of course understanding there is also some overlap. Some intersex people may also identify as a trans people. So all these are very important for you to know in this 2-day workshop. I'm glad that all these are going to be covered in detail in the next 2 days. I have seen the agenda, so it covers comprehensively all this detail. Of course, just a few key points I want to emphasize from my presentation. One is understanding and respecting the identity, using correct names, the chosen names of the trans people, and using the correct pronouns, or at least like using a gender neutral language when we talk to them. So all these are very important because it's a respect to a fellow human being. We are respecting how they would like to be recognized as. So that I think that itself may be very important gender affirmation for them. Medical gender affirmation is part of it, but it's also social gender affirmation. Acknowledging them with the proper names and pronouns are very important. Of course, I also want to highlight the resilience among the transgender people. We talked about like mental health issues, but there is also resilience, like they bounce back from the mental health issues because they also have their own peer support. So that also we need to keep in mind, not just only looking at, say, they may have mental health issues and problems. In the morning, there was a discussion that these mental health issues like depression, anxiety are primarily because of the societal stigma and discrimination. It is not because I am transgender, I am more prone to high levels of depression and anxiety. I also emphasized in the morning about having inclusive environment from the front desk, the reception, until they undergo operation or they get hormone therapy. All kind of staff need to be sensitized and trained, not just only the technical training for the doctors and the nurses, but all kind of staff need to be trained. So of course I just echo the words of the previous speakers. Continuous learning, we need to keep learning. New things are coming up, guidelines and best practices also they are constantly updated. But let us use this training as a springboard to transform, like how our institutions can be more inclusive and provide better care to all kinds of people. So thank you once again for your dedication advancing health of trans people and people with intersex variation. Thank you very much for having me.